Introduce our first speaker. Our first speaker is one of Australia's most published authors on mentoring and has 30 years experience in learning and development and a background in career counselling. I'll talk to you after this session, Anne. For 2 decades, Anne has specialised in mentoring, setting up programs and training people in the fields in all sorts of fields such as health, construction, energy, communications, education, law and government. And Anne has spoken at national and international conferences in Australia, Canberra, China and the USA. Anne's contribution to mentoring has been recognised with the 2011 LearnX Asia Pacific Platinum Award for Best Coaching, Mentoring, Training Program, and in 2013 the New South Wales Juvenile Justice Excellence Award for Innovation. Anne has facilitated focus groups, interviews and surveys to identify barriers to career advancement for women, diagnose training needs for mentor coach instructors in highly specialised professions and assess effectiveness, challenges and success of mentoring. This year Anne undertook research with the Australian Medicare Local Alliance and the University of Canberra, and she's going to talk about that today. So could you give a big welcome please to Anne Rolfe.
Yeah, sometimes Canberra seems like another planet, not only another country. So thank you very much for coming along to this session, and quite excited to be here, even if the microphone isn't. I did mention to my colleagues before, I'm going to do something quite uncharacteristic. I want to actually read from my presentation today. Normally I get up here and actually present and talk with you, but I just want to make sure I get this right for you. So I need to say first of all that Nurse Leadership Barriers and Enablers is an initiative of the Australian Medicare Alliance. My co-researchers, Lynn Walker from AMLA, and Associate Professor Rhianne Parker from the Centre for Research and Action in Public Health at the University of Canberra, and we were assisted by Karen Young from AMLA. The project was funded by the Australian Government, and it was designed to provide evidence to inform the development of policy to support nurses to develop leadership skills so as to contribute to the planning and strategic direction of Medicare locals. And I guess the information that I'm going to share with you is going to be relevant and useful regardless of what the future holds for any of us. Because one thing I've learned after 45 years I've been in the workforce, and a lot of that has been around government bodies and agencies as well as in the public sector, and nothing stays the same for long. Everything is changing. So the brief was to ascertain the barriers and enablers of nurses seeking leadership positions on primary health related committees, including Medicare local boards of management. And the project investigated the core skills, education and support required for nurses to feel confident to be able to contribute to their strategic direction of Medicare locals. The project scoped the different levels of leadership and the development options, whether it was career development, mentoring, networking or other forms of development, available to seek each leadership role. So the project was in 3 parts. We had the literature search, we had interviews and we had an online survey. So the literature search really was to identify the core skills for nurses with specific attributes enabling nurses to gain board memberships. The interviews then were nurse members of boards. So these were nurses who were already on health-related boards, and it focused on those barriers and enablers to gaining board roles. And then the survey was to assess the levels of aspiration, confidence and the capability for leadership, as well as nurses' experience and desire for mentoring. So nurse leadership, it's kind of a very broad term. So what we actually looked at was different kinds of leadership. And although I've kind of displayed them in a hierarchy, I'm not sure that that's really a great way to look at it. So here it is anyway. We can look at nurse leadership in terms of encompassing workplace leadership. So things like initiating a new procedure, training or mentoring staff, educating or advocating for patients. Then professional leadership. So speaking up in a group, presenting to or facilitating meetings of health professionals. Then there's organisational leadership in a role such as a nurse unit or department manager, director of nursing, practice manager or a CEO of a hospital. And then there's industry leadership within committees, advisory boards or boards of directors. So into the research then. So a brief review of literature revealed that there are in fact current leadership capability frameworks. Nothing in the broader literature search really said anything to contradict anything that I looked at in those models. But some of the research on women and leadership, as well as the interviews, indicates a number of barriers that need to be addressed if nurses are to fulfil their leadership potential. So the Canadian LEAD model, LEAD, informed the Health Education and Training Institute's New South Wales Health Leadership Framework and the Health Workforce Australia Australian Health Leadership Framework. Now, the evidence-based Canadian model lists 5 interdependent domains of leadership capability in a caring environment, and they're these. Firstly, lead self. Be self-aware, manage self, develop self, and demonstrate character. Engage others. Foster the development of others, contribute to creating healthy organisations. Achieve results. Set direction. Strategically align decisions with vision, values, evidence, action decisions, assess and evaluate them. Develop coalitions, and I reckon there might have been a bit of that going on over the last 2 days. Purposely build partnerships and networks to achieve results. Demonstrate commitment to customers and service. Mobilise knowledge and navigate socio-political environments. And system transformation. Demonstrate system critical thinking, encourage and support innovation, champion and orchestrate change. I like that word, orchestrate. You know, do you ever see the person at the front of the orchestra, the one with their back to the audience, but the full attention of every musician in that team that's producing something wonderful? So having done the literature search, we went on to do the interviews of nurse leaders. So it was a kind of a telephone online interview. And what we focused on there was the barriers and enablers. These were nurses who had gained a role on various health-related boards. And the responses indicated that the central attributes nurses need to become directors in Medicare local boards include these. Confidence, not a surprise I imagine. A positive self-perception as a health professional. Belief in nurse competence and capability. Willing to step up. Able to speak up. Desire, vision and a degree of courage. I like this term, I don't know what you'll think of it, but I call it out there. Not only because it fitted the acronym I wanted to use, but because it kind of summed up what the nurse leaders in these roles told me. They were active in professional development. They were active in associations, forums, networks and community groups, not just health. in community groups in their local areas, taking opportunities to lead within and outside of their practice, joining committees. Readiness. Being at a stage in their life and career where they were able to commit, they had the available time, they were prepared for the additional responsibility, challenge and learning. Having a profile or an image as an interested professional and finding and using mentors. Experience and education, yep, it was there. Some understanding of board function, responsibilities, finance, corporate governance, strategic thinking and communication skills. Now, qualifications are an asset. You want to guess how many of this group had none other than their nursing qualifications? These were nurses who were serving on high-level boards. Didn't have a qualification other than their nursing qualification. Qualifications may not be as important as you think when it comes to making a contribution at the strategic level. So harnessing the transferable skills and experience, their ongoing development and willingness to learn and grow are more important, and mentoring plays a vital role there too. So then we took these issues and we explored them in the online survey. We got responses from 179 primary care nurses, 68% were employed in general practice, 14% in Medicare locals and 18% elsewhere. They came from all around the country, except for some reason from the Northern Territory. Don't know why that was so. Although I have to say the analysis is not complete at this time, some of the important things that the data show are these. There's no lack of leadership capability amongst nurses. 75% of our sample were or had been employed in nurse leadership positions, 23% had non-health leadership positions, 71% had voluntary leadership roles, and that included everything from being on a parents group committee, a sporting group committee, a leadership role, to NGOs and charities. 43% had owned and managed or been partners in their own business, yet only 3% were on Medicare local boards. When it came to participation on boards, apart from the 3% on Medicare local boards, 31% had participated in other boards, 62% on health-related committees or subcommittees, and 76% on other kinds of committees or subcommittees. In my view, there is evidence that many nurses have leadership capabilities, but their leadership talent and potential is underutilised in the planning and strategic direction of Medicare locals and perhaps health in general. So what's stopping them? It's not that nurses don't aspire to leadership roles, because only 18% in our survey responded were definite in saying no, they didn't want to do that. And leadership isn't for everyone, okay? And it's a valid choice. But of this sample, only 80% said, no, it's not for me. Indeed, some were very passionate about contributing, and these comments will come as no surprise to you. These sorts of things that they said, largest group, smallest voices, unless we get on the boards, and I like this one in particular. So there's aspiration to leadership, there's capability, but there are barriers. And here are those that the respondents actually identified. Maybe no surprises here. As you'd expect, nurses are busy people who juggle a lot of commitments, and time is their biggest barrier. But as you can see, there is also the perceived lack of knowledge and skills or experience, and that lack of confidence that holds nurses back. It's more than distance, though many mentioned living in rural areas where travel is an additional obstacle, more than family commitment, lack of support, the cost, and the perceived bias. Again, some comments, typical comments that came out of the responses. This one strikes me most of all. So we'd like to think that rising to leadership roles would simply be a matter of having the necessary competence, but it's not. In fact, what we know when it comes to leadership, confidence is actually more important than competence. I don't know if that surprises you. If it was just competence, we'd see a lot more nurses on boards, and in fact a lot more women on boards generally. So we asked respondents to rate their confidence, and interestingly, on a scale of 0 to 10, a substantial number indicated that they were confident to perform in these roles, and even more so if someone from that group came forward and asked them to participate. So we need the tap on the shoulder, we need the invitation, we need the personal approach. Because time and commitment is the number one issue, it's evident that there are choices that must be made if one is going to advance. There are choices about priorities. Perhaps there are trade-offs, negotiation in one's personal life. These choices impact on career and life. So what we know is it's not just competence that allows people to move up. It is, in fact, competence, and that may be more important than confidence. But it's also these choices that are significant and important. So, in kind of coming to a close, only you can make the decisions that are right for you. But a mentor can help you examine your values, priorities, and make those choices. Only you can build your competence. But a mentor can assist you to see the strengths you already have and those you may need to develop. Only you can find the courage to take the steps, but a mentor will help you as you grow your confidence. So, if you dare to lead, mentoring works. Thank you.